Well, what a pleasure to be here with you all. Thank you very much. I should say, as I start off, that the Surgeon General sends her regards, and I'm really honored to be here with many of the leaders of public health across the nation. In fact, we've heard from a number of exceptional speakers throughout these 2.5 days, from Governor Pat Quinn, as you recall, talking about the virtues of our efforts in public health, and the walk across Illinois with Dr. Quentin Young for universal health care. From our ex-governor Granholm, providing her insights with comments like, what are they thinking? As well as the point that hatred of government is really a form of self-hatred. And I have to say, for those of us in federal uniforms, that's really schizophrenic. She also talked about APHA as radicals and that an intervention is needed. You know, the speakers have been very inspirational throughout these 2.5 days, and I hope you've been as inspired and motivated as I have while we're listening to the speakers, many of them the global leaders in public health. Many of them spoke of substantial challenges and the political realities and budgetary realities that are facing us. Many many of us have been very aware of the personal realities of budget cuts, the personal realities and heart-wrenching effects of budget cuts on our colleagues, on our staff, and on those we serve. Many of us were disappointed when the Affordable Care Act didn't include a single-payer option. But let me say without equivocation that the ACA offers us a tremendous opportunity to move forward as it is. This is reality. This is what we have, and it offers tremendous opportunities, and I'll share some of those with you as we move forward to improve the health of those we serve. Let me... Let's talk about a few of those, and I'll move pretty quickly. The Affordable Care Act we've heard about throughout several of these sessions, and I won't spend a lot of time on them, but the benefits to those we serve are fairly significant, clearly. And it's also clearly significant that the word has to get out to those we serve so they can enjoy these benefits in our current political climate. So to mention very briefly, some of the things that the Affordable Care Act has brought to us: strengthening community health centers, one of the backbones, in my opinion, of public health and public health care as well. Certainly coverage for young adults, 1.2 million between the age of 18 and 26 now. One of those areas where analysis has shown they have the greatest lack, or the greatest shortage of insurance coverage. Stronger Medicare and savings for seniors. We know that seniors will save up to $3,500 over the next 10 years. We know that we've been able to decrease the size of the donut hole. And in fact, seniors got $250 each last year. And by 2020, the donut hole will be gone. Now there's a 50% discount on brand name prescription drugs available to seniors. Some support for small businesses and business provided care and coverage. So tax credits of up to $40 billion for small businesses. Importantly to me, free preventive care. 88 million people will receive free preventive services without a copay. That includes the things that we're all very aware of: the cholesterol checks, the blood pressure checks, the colonoscopies, the mammographies, and many other preventive services that are now available at no cost. What about the ban on discrimination against women? They generally have had to pay higher rates just for being women. That's gone, as well as the ban on discrimination against children with pre-existing conditions. Up to 90,000 children across our nation will no longer have specific benefits denied because of a pre-existing condition. These are impressive changes. Ban on lifetime limits, up to 20,000 people who typically hit their lifetime limits, and nearly 102 million enrollees in plans without lifetime limits no longer are forced to go without treatment or to go broke in the process. If you make an error on your application form for an insurance company, a simple error, you can't be rescinded. Ban on restrictions for annual limits. We know that the limits will be completely eliminated in 2014. No restrictions on where you get emergency room care. Up to 88 million people will benefit from this new rule. Protecting health care for early retirees, that other benefit, that other big group that has poor coverage for insurance between employment and before Medicare. So more than 5,400 employers, state and local governments from all 50 states are participating in what we call the Early Retiree Reinsurance Program, and 88 million people can benefit from this rule. Better value for premium dollars. Certainly we know now that because of this law, 80% of the premiums that are paid have to go back into health care for the individuals that pay those premiums. Choice of physician. 88 million people who enroll in new plans will be guaranteed their choice of available primary and pediatric doctors. And there's a number of more benefits, a number of additional benefits in the years ahead, including exchanges offering affordable quality coverages and options, tax credits, expanding the coverage, and reducing the deficit, as we all know from the government reports. So more than just coverage, our Affordable Care Act has really focused in as an opportunity for public health as well. Clearly, we know that there are new investments in the workforce with National Health Service Corps expansion, near and dear to my heart, as I started in that effort in the Indian Health Service, with a goal of 12,000 new primary care providers in 5 years, utilization of those providers in integrated team-based methodologies for care, with an integration of prevention, and we all are very aware of the Prevention and Public Health Fund, with funding of the public health infrastructure, the public health workforce, and public health capacity in the tens of millions of dollars. Chronic disease prevention is another area where the Affordable Care Act has made some substantial inroads, and focusing on areas that are, again, near and dear to my heart as a cardiologist, heart disease, with major efforts going into focusing on the ABCs of heart disease: cancer, stroke, diabetes, and arthritis. With $40 million going, as just recently announced, to strengthen and coordinate the activities within the states. And we're all aware of the community transformation grants that just came out for over $100 million as well. So there's been some big impacts from the Affordable Care Act. It's not perfect. We don't pretend it is. There's been a tremendous effort to hear everyone and to integrate those recommendations into the Affordable Care Act as it's gone forward, into the implementation of the aspects of the past bill. And as we move along, one of the big steps that's been made is the National Prevention Council, which, as you all know, is made up of 17 heads of government, from Department of Defense to Transportation to Agriculture. Cabinets on the President's Council, led by the Surgeon General, to focus on prevention. And as you all are also very aware, recently, in the past 2 weeks or so, this National Prevention Strategy has been released based on a lot of the work of people in this room. The vision is to work together to improve health and quality of life by moving the nation from a focus of sickness and disease to one based on prevention and wellness. The strategic directions are areas where we all are very passionate: healthy and safe community environments, clinical and community preventive services, empowered people, and the elimination of disparities. this offers real opportunities as we move forward in the implementation and direction of our work in public health. As we know, this is the graph that goes with that strategy. And in the center of the graph is to increase the number of Americans who are healthy at every stage of life. Great work's been done on this. One other area that I wanted to mention that we didn't talk about too terribly much throughout the conference is the health IT part. Incredibly important as we move forward to improve the health and prevention throughout the nation. But one piece of that I think is of particular import is the consumer piece. Empowering the consumer so that they can own their own medical record, or at least have control of their own medical record, and utilize it in the way that they see fit. So there's a health data initiative, healthdata.gov, that's been headed up by Todd Park, the Chief Technology Officer of HHS, and has focused on a number of these aspects, one of which is a consumer piece that is finding a home right here in Chicago to try and empower consumers in health IT. These are some of the websites that are worthwhile mentioning if you're not aware of them yet. But certainly worthwhile being aware of and knowing about, and where possible, where appropriate, spreading the word. Now, many of us in public health feel like this, like the individual inside this igloo. Our profession of public health has made some of the greatest strides in the world. In fact, the greatest strides in the world in the health of us as human beings. Certainly through efforts at prevention, fighting disease and pestilence, combating epidemics, sanitation, disaster preparedness and response, and now with health and wellness. We have an incredible history, and we also have a powerful mandate. We're posed to implement dramatic changes across our nation that can bring us to the pinnacle of public health throughout the ages. We're also challenged with, as Dr. McDonough said, I believe it was yesterday, with one of the greatest assaults on public health in our nation's history. Speaking of the budgetary issues that are going on. We're clearly at a crossroads. Both our opportunities and our challenges are arguably at the height of all time. Let me just say that there's been no greater time for us to stand together for the health of our families, our friends, our colleagues, our communities, and our nation. We have inherited the nobility of those great men and women who preceded us, the responsibility for social justice across the nation and across the world, and I believe we're up to it. Thank you very much. Oh, I have one more slide that I'd like to add. For those of you all like me who were educated in the last century, you may recognize the author of this quote. It's, somebody has to do it. It's just amazing it has to be us. So, thank you very much.